Good morning. Welcome back to Open School. This part of a case-based discussion, a patient with Galactorrhea, amenorrhoea. We'll go to the history. A 44-year-old female with past psychiatric illness was treated with oral risperidone 3 mg twice daily and citalopram once daily 10 mg. She developed a spontaneous milky discharge from the nipple and on inquiry reported that there are no periods for the last 3 months. Serum prolactin was done. It was 53.32 nanograms, normal 20 nanogram. So this patient has got galactorrhea, amenorrhoea and increased levels of prolactin. So this is what is a galactorrhea amenorrhoea syndrome. There are different causes for galactorrhea amenorrhoea. Other than pregnancy, this may be due to hypothyroidism, pituitary tumors, and most important, drugs. Most of the antipsychotics, especially atypical antipsychotics, can lead on to. Among the typical antipsychotics, it is risperidone, which can lead on to galactorrhea amenorrhoea syndrome. So, in order to understand the mechanism, you should know something about the action of the antipsychotics. Antipsychotics are basically divided into the typical antipsychotics that blocks the D2 receptors predominantly, and the atypical antipsychotics which act on the 5-hydroxytryptamine receptors also. They are the antagonists. Mainly we have got 4 pathways where dopamine is the important neurotransmitter. We'll take one by one. We are all familiar with the nigrostriatal pathway. This is concerned with the movement, motor activity, that is the, and a blockage of this receptor dopamine will lead on to extrapyramidal features. That is why D2 blockage lead on to various extrapyramidal manifestations. Next is the mesolimbic pathway. This is concerned with the pleasurable activities. Lack of activation can lead on to not experiencing pleasure in daily activities. Anhedonia. Then the mesocortical pathway. Overactivity leads on to many positive symptoms, hallucinations, delusions, bizarre behavior, etc. Another important pathway is the tubero-infundibular pathway, concerned with the secretion of prolactin. The tubero-infundibular pathway is particularly important in that dopamine is the neurotransmitter that blocks the secretion of prolactin. So, dopamine inhibits the prolactin release. So, if you are giving a D2 blocker, what will happen? The inhibition of prolactin secretion is lost, and this will lead on to galactorrhea. The mechanism of amenorrhoea we will discuss on another day. So, today we have discussed about the various pathways concerned with the antipsychotic activity. In the next session, we will be discussing little more detail regarding various antipsychotics. Thank you.